If you buy your own health insurance, you may have opened a bill this year that was double or even triple what it was back in December, and you're not alone. Millions who buy their own health insurance watched premiums spike almost overnight. Nearly 3 million Americans have already dropped coverage. CBS News medical correspondent Dr. Céline Gounder joins us now. You know, she's also the editor-at-large for public health at KFF. Dr. Gounder, good morning. What actually changed and why are people seeing these spikes, which I guess is also forcing them to walk away in some cases?
Right. So for the last 4 years, federal subsidies have capped what people paid for coverage. But then, and this is, by the way, what the government shutdown last fall was about, was a fight over whether to extend those subsidies or not. Well, Congress let those expire, so those expired January 1st, and overnight, the average payment people were making jumped almost 60%. And as a result, and also deductibles rose by an average of about $1,000. And so more than 90% of people enrolled on the ACA or Obamacare exchange had help from the federal government, over 90%. And so as a result, many now cannot afford to continue on those plans.
People are already dealing with higher prices everywhere. And I understand insurers want to raise rates again. What's happening there?
Yeah, so this is the result of a few different things, rising healthcare costs, but also when the people who walk away from health insurance are the healthiest, the people who are left behind are sicker. And as a result, your premiums goes up because those people who remain are higher risk. It's what experts call the death spiral. And so that means the premiums go up and up and up. More people walk away. You're left with more and more sick people. Premiums go up. And that continues. That cycle continues.
But this isn't just a budget story then. It sounds like this really is an overall health story.
Well, the problem is that when people feel like healthcare is going to be expensive, they delay their care. I see this all the time. People have put it off, put it off, put it off. By the time you see them, they're really sick. And then that means the health care that they're getting is also at a very different stage, much more expensive, and the outcomes are just not as good.
So I wonder if you would encourage people to get the care and help they need, but people have to budget. Can anything be done before next year?
Well, currently this sits with Congress. So there's a Senate proposal from Senators Susan Collins and Bernie Moreno, both Republican senators, by the way, that would restore the credits for 2 years through the end of this current administration. And it's drawing support from both parties. This is bipartisan. And there is proof that this approach works. So New Mexico, for example, when the federal subsidies were lost, they replaced those subsidies with state subsidies. And they actually are the only state where enrollment has risen. So affordability is a huge issue here. If people find insurance to be affordable, they're more likely to sign up.
So maybe states can replicate what New Mexico is doing. Fascinating. Dr. Céline Gounder, thank you.